Welcome back to the Healthy Commute. I'm Dr. Dan with Dr. Pascal. So today we're going to be talking about health. We get this question maybe a lot when we see patients, and they may say things like, oh, I'm just, breaking down. This is normal. I'm getting sicker. This is normal. Or I have to work really, really hard just to get out of sickness. Yep. But really, we have to get back almost to basics, which is understanding what is health and what is normal for our bodies.
Absolutely. I think people assume that our bodies may be designed to break down with age, right? And I think as time goes on, people are almost assuming that earlier and earlier, and I think it's because people are developing maybe bad habits earlier on, and people are coming to see us with pain and health conditions in their teens and 20s and 30s now, and they're like, well, I've heard it before, like, well, maybe this is just because I turned 30, like, things are starting to break down, right? Yeah. And so I think at large we have this perception that maybe our health peaks in our 20s and 30s, and it breaks down from there, right? But it's not necessarily true, is it?
Right, no, and I think we have to understand what normal is, and health is normal. I'm just going to say it, health is normal. And the body was designed to work well. When it doesn't, there's always a reason why, right? For us as chiropractors, we want to understand how that brain to body connection is working, and is there any interruption, kind of like a circuit breaker in the house or a computer network that's not connecting well. There's always a reason why. And same thing for sickness and disease that comes up, whether we're talking about type 2 diabetes, heart disease, cancer, what is allowing the body to break down, and maybe what are interruptions in normal patterns that are causing this body to break down.
And I think we could probably even start by stepping back, because it goes even further into maybe at large we have a misunderstanding of the definition of health, right? And I mean, we hear this all the time too, like, well, something doesn't hurt, I must be healthy, right? Or I don't have any symptoms, I'm healthy. And so we've associated, or we've been conditioned to believe that without symptoms, we're healthy. Right? It's like, if I feel good, I'm healthy. And then as soon as something breaks down or doesn't feel good, well, I'm not healthy. And I don't want to say it couldn't be further from the truth, but we have to kind of reassess how we interpret health and what the true definition of health is.
Right. And like, yes, like you said, symptoms and health. But the other thing is, and we talk about this with our patients a lot when they start their care, is understanding symptoms, but understanding function of the body, and really looking back at, okay, what is my body trying to do? So we give the example of, let's say we go out to eat to a restaurant, and we, for whatever reason, we get some bad food, some food poisoning, right? What would be a normal, healthy response when we're eating that food poisoning? What should we do?
Well, our body wants to get rid of it, so we should expel it.
We should throw it up. It should come out the front, out the back. It should come out of everywhere. But a lot of times, right when that happens, if we were to ask someone, okay, is your body healthy or is your body sick?
Knee-jerk reaction.
Right, and we go, oh, we're sick because I'm throwing up. But really, the definition of health is our body's ability to function and heal and adapt on a daily basis. Absolutely. So meaning that if I'm doing something or I'm eating something and my body needs to adapt, then a good healthy reaction is to get it out. So I would say, no, actually your body is super healthy. The sick response to me would be a body's inability to recognize that that's food poisoning, and their body's inability to get rid of it. So now that person may be across from you as you're eating dinner, they're like, oh no, I didn't get sick. Well, actually, no, that's actually worse because you didn't get rid of it.
Right. Yep, absolutely. And I think we could even look at COVID. This is a perfect example of a large part of the measures that we were taking were to strongly protect the immunocompromised, right? Those people that don't have a strong immune system. Because what their immune system isn't able or as apt to do is to fight off the infection like someone who might be younger and healthier, right? And so what we were doing is taking all these measures to not expose those people to a virus that their body cannot fight, because that is the true definition of sickness, is someone that cannot adapt and fight different viruses, bugs, bacteria. Their body cannot heal and function the way it was designed to do.
Right, and sometimes, even we see that in, even before COVID starts, right? If someone's going to the hospital to see someone that was sick or not, feeling well, signs are all over the hospital saying, well, if you are sick or not feeling well, don't go in there. And the question then would become, okay, well, what's different between, let's say, the person that's trying to come into the hospital to see their loved ones and that loved one in the hospital, right? So it would be dangerous for them, because what their bodies can't do right now is adapt and change and heal and fight. So whereas what we want is a body that can adapt, can heal, can do whatever it possibly takes from a day in to day out to fight to return to that new normal of being healthy. That's where it should be.
Absolutely. And I think that's great advice to try and even, like, the first step of helping people starting to get well is changing and flipping that mindset and having them understand that, hey, if we start doing the right things, your body can start to function and heal better, right? And maybe that healing process is slowed down. And if the healing process and the immune system aren't functioning properly, maybe some symptoms start to appear, kind of like check engine lights in the car. They're telling us that there are problems that are developing. But if we start to do things to improve health, whether that's exercise more and sleep more, improve, like the way that we help people is by improving their posture, their spinal health, getting their body moving better. You start putting all these positive inputs into the body, and by doing that, the body is now able to start functioning and healing better, right? So we're reducing what we call external interference, interfering with your body's ability to heal.
Right.
So the goal is to always put positive inputs to the body so that it can continue to function and heal. And it's never too late, right? Like, people in their 30s, by no means is it too late to start healing and functioning better, because we could see it in your 30s, 40s, 50s, 60s. We see it. People in their 70s and 80s, right? I mean, they're improving their quality of life, feeling better, functioning better at later years because the body still has that ability.
But I mean, speaking of that and doing all these right things, that made me think of, let's say a patient walks into the office, right? And they have a problem. They have something that is not feeling well. And they want me to do what?
Take the pain away. Doc, fix this.
Take it away. And I get it. I would want the same thing. Get rid of this. But even me or you or any chiropractor, any doctor, anything else, is they cannot go into the body and remove the problem and remove the sickness. The only thing we could do is remove the reason why the body was breaking down. Almost like, well, why is my garden not, thriving? Is because the hose is kinked. So I can't make the garden grow. All I could do is unkink the hose to allow water and everything to go back to the garden for it. A natural ability of the garden is all it needs is water, sunshine, a good habitat, and things will grow. That's normal health, just like our bodies.
Absolutely. And I think, a great way to even just understand the basic principle of healing is like a cut, right? If you cut your finger, right, you washed it up, put a Band-Aid on there, you don't need a doctor. You don't need a pill, you don't need a medication, you don't need no special rub. All you really need is just a little bit of time for your body to heal it. And all of a sudden, new skin grows, scar tissue forms, and voila, a couple weeks later, you might not even know that you had cut your finger, right? Your body can fix it, can heal, and heal itself. Now, of course, there are limitations, right? And I think a good way to understand what we do as chiropractors, and it's very similar in a sense of someone's doing surgery, is like, you always tell patients this: if I'm hiking and I break my arm, and it's a significant break, my arm shoots out to the side, the bone's piercing the skin, can your body heal that on its own? Absolutely not. There are limitations to the body's matter, right? But if you see a surgeon who could put a plate on there, cast it, put it back in position, now once the arm is held in position, can the brain and the body recreate the health in the arm and fix it as good as it possibly can so that you regain use of that arm? Yes. Right? And so we try to teach people the analogy that we're trying to do the same thing by trying to help the spine be in a better position so the body can function better. When the body functions better, not only can you experience overall better health, but generally the pain's going to go down because there are less problems with the spine. Right. So it's teaching people that we're not adjusting pain, we're adjusting the spine so that the body functions better. It functions better, pain naturally disappears and goes away.
So all that to say, it's normal to be healthy. Now, a patient or a person might be thinking, okay, great, that's all great. Now what do I do? How do I, kind of allow that to happen? And I think it's the philosophy is really important to kind of start with, which is wherever you are in that spectrum, whether you think you're as healthy as you possibly could be, or you think that there's nothing that could be done to get you back on the road to health. I think the understanding is just understanding, okay, so it is normal for my body to be healthy. So what steps can I take to allow my body to be in the best environment to thrive in? So then we could start talking about, yes, our nerve system, right? Our spine and nerve system. We could talk about sleep. We could talk about nutrition. We could talk about exercise. We could talk about water, proper vitamins and minerals, proper, mindset.
Meditation, mindset,
probably,
yeah.
all these things all those things do is we want to remove interference to allow things to just function. So maybe for you, wherever you are, it could be one step. What one step can I take to go down that road? Can I improve this? Can I improve that? And I think part of the thing is sometimes people get overwhelmed with so many things, and one of the most important things that usually gets people to do things is just one step at a time.
Small, simple. Yeah.
One simple thing.
Yeah.
And I was talking to a patient the other day. She goes, all I need to do is put my leggings on.
Yeah.
If I put my leggings on, then I'm going to do my workout.
Yeah.
But if I think about just doing the workout, I'm not going to do it. So just one step at a time, just put my pants on, put my shorts on, put my shoes on, and then the next step is to actually do it.
I mean, it could be as simple, if you just want to take one action step, increase your water intake. Good, clean, purified water, increase your water intake. Or, get the extra 30 minutes of sleep, or get the leggings on to do the workout, right? It doesn't have to be, I think you listed 6 or 7 different avenues that someone can use to improve their health, to improve or to let their body improve its health, we'll say, right?
Yeah.
But that could be overwhelming, you're right. If you feel like you're lagging behind in all those, pick one step, move forward in the right direction, and don't beat yourself up when it doesn't always move according to plan.
Yes. So hopefully that gave you a little bit of understanding of what health is and how our bodies are supposed to work, and maybe some things that you could do to start to improve your overall health. But again, any questions, concerns, comments, please let us know. Either email us here at the office, info@lindenwoodschiropractic.com, or give us a call at 204-474-1159. Have a great rest of your healthy commute.